Hi everyone, welcome back to my channel Shruthi Nursing Officer. Okay, previously we are discussing about the hormones, right? Today we are going to discuss or know about the PCOD. Nowadays you can heard the word that the so many women are suffering with the PCOD, right? What is this PCOD or the PCOS means? PCOD is nothing but polycystic ovarian disease, and PCOS means polycystic ovarian syndrome. See here, you can see the PCOD. In that PCOD only we'll get the meaning that polycysts. Okay, so many. Poly means so many cysts are going to happen in the ovaries. Ovaries are the main female reproductive organs. Okay, what are the main functions of the ovaries? The main function of ovaries are the hormonal production, maintaining the menstruation, as well as the maintaining the pregnancy, right? Here what happens in the PCOS means because of the hormonal imbalance, those are releasing by the ovaries. What are the hormones released by the ovaries? These are mainly the estrogen, progesterone, relaxin, okay, inhibin. So many hormones are produced by the ovaries, but we'll more concentrate on the estrogen and progesterone. Okay, because of the improper secretion of these hormones can leads to the PCOD in the females. Here mainly the PCOD is a hormonal condition which mainly affects the 5 to 10% of the women. Okay, mainly from the age group between 12 to 45 years of age. Okay, from 12 to, that is the 12 to 15 age is called as childbearing age. During this time only mainly the 5 to 10% of the women are suffering with the PCOD. Okay, in India nearly 9 to 22% of the women are suffering with the PCOD. Okay, so 9 to 22% only in India. I am telling you that only in India 90 to 22% of the women are affecting with the PCOD. Don't skip the video. If you skip the video, you won't get the proper information regarding the PCOD or the PCOS. Okay, see the video completely, and this is the brief and very little bit big video than the previous. Okay, so in the previous we are going to know the difference between the PCOD and the PCOS also. Okay, don't skip the video, continue. Imbalance of hormones of the woman is the main reason because of the main reason for the PCOD. Okay, so this what happens here, what happens in case of the imbalances of the hormones produced by the ovaries, those are estrogen and progesterone, can leads to absence of ovulation. Here the ovulation is very important for the menstrual cycle as well as to conceive. Okay, so there will be absence of ovulation will be there. Because of absence of ovulation or the improper ovulation process, what happens, and the irregular menstrual cycle will be there. Okay, if the irregular menstrual cycle, the woman is unable to conceive or to get pregnant, because here what happens, the proper ovulation process should be in such a way that if the sperm has to meet the ovum to form the zygote and to continue as a pregnancy, the matured ovum is very important. Okay, we should have the all the genetic characters. Okay, so in order to maintain the hormones or the because of the hormonal imbalance, what happens, irregular menstrual cycle will be there. Irregular menstrual cycle, because of irregular menstrual cycle, there is a difficulty in conceiving. Okay, then what may be the other cause? You can heard that those who are suffering with the PCOD or PCOS, they will be having a weight gain. Okay, because of the hormones, the weight gain will be there, along with the all over acne all over the face. Okay, facial acne or body, complete bodily acne will be there. And the hirsutism, what is this hirsutism means, the female are going to develop a hairy structures, those hairy thick hair formation in their bodies, mainly the hands, face and the legs, like a male pattern. How the males used to get the beard or the mustache in a thick form, no, like that only the female uh, going to get the thickened hair. Okay, then here, what is then when the PCOD is not at all maintained properly or continue, means it is not properly prevented or take care of the PCOD, it can lead to PCOS. Why it is called as PCOS? Mean polycystic ovarian syndrome. It is syndrome is group of conditions or the group of symptoms are called as syndrome. Okay, PCOD is only condition. Here the cysts are formed and it can be managed in the early conditions, like maintaining the lifestyle, diet modification and all, and taking the proper treatment. If you end up with the PCOS, it can leads to the type 2 diabetes mellitus. You can be a overweighted person. Okay, so please take care of the PCOD in the initial stages itself. Okay, then what happens in case of, I already told you, if PCOD is not treated properly, it can lead to the PCOS, right? If PCOS there, the particular female can end up with the, if it is not properly diagnosed or treated, it can lead to the type 2 diabetes mellitus and end up with the obesity and heart diseases. There is the chances of heart diseases and increased cholesterol level. Okay, then how can you know, and how can you know whether I am suffering with the PCOD or PCOS? Then the signs and symptoms of PCOD or PCOS. As I said you already, what are the signs and symptoms? The same thing happens. Here what happens, there will be a increased androgen level. What is the androgen levels? Means this is a male hormone. In case of PCOD cases, what happens, estrogen progesterone level decreases and the androgen level increases. So in this case, we'll be having the, these male hormones are going to leads to the excess facial and bodily hair, which can lead to the excess facial and bodily hair, and which can lead to the irregular periods, right? Improper ovulation leads to the improper or the irregular periods. Irregular periods are there, the female is unable to conceive. Okay, this, and there may be a hair loss will be there. Okay, hair loss is also main signs and symptoms, and acne all over the body and the weight gain will be there. Okay, these are the signs and symptoms. By this way we can diagnose some of the signs and symptoms of PCOS. Okay, then what may be the causes? How we can, every woman won't get the PCOS or the PCOD. Here what happens, there are some of the causes mainly which trigger the PCOS. Which are those? Mainly the family history. Here, if women suffering with the particular gene is not responsible for the PCOS. If the any of the person, those who are in the family are suffering with the PCOS or the PCOD, means there may be a chances of getting the PCOS for the other women in their family. Then here PCOD, if it is not untreated, it can lead to the PCOS, and which can lead to type 2 diabetes mellitus. What is type 2 diabetes mellitus? Please comment in the comment box. Okay, as I already discussed about the PCOS and the type 2 diabetes mellitus. Don't forget to comment. Please comment what is type 2 diabetes mellitus. Okay, next, what are the causes? Insulin resistant. Here, how insulin resistance can cause to PCOD? Any idea? Here what happens in case of insulin resistance, what happens, the insulin is not at all properly producing. Okay, the insulin resistance cases which result the genetic factors. Those who are suffering with the insulin resistance, they can transfer their genes to their offsprings, right? So in this case, there may be a chances of getting the PCOD. Then what is the next one is, always I said you, one of the main signs and symptom is increased weight or the overweight. Try to avoid your overweight and do some of the physical exercises in order to maintain your skin as well as the your physical health. Please try to maintain your normal body weight. And increased weight is also increased overweight and increased overweight. Okay, next, how we can diagnose the PCOS? For example, if woman is came to hospital and she gave a history of irregular menstrual cycle, or they are failed to conceive, okay, even though repeated chances, and they are unable to conceive after the 3 to 5 years. They, if even they are got married 3 to 5 years back also, they are unable to conceive with the irregular periods, we can diagnose that PCOS with a form. Pelvic examination will be there along with the blood tests in order to know the hormonal level. Okay, then mainly we used to go for the USG, okay, ultrasonography, for the presence of cysts. Cysts means any the fluid filled sacs in the ovaries. Okay, these are mainly the how we can diagnose regarding this. Then what is the treatment? Is there any treatment for the PCOD? Yes, of course, definitely. Why? Because PCOS is the major condition, but PCOD can be manageable. Here what happens, PCOD, because of the treatment, what are the treatment we are going to give? As I said you already, the diet and the lifestyle is very important. Okay, keep in mind, diet plays a very important role. Okay, so diet, I will tell you further, don't skip the video, because what is the diet pattern we have to maintain if we have the PCOD or the PCOS. Okay, lifestyle, if the person is suffering with the what overweight, lifestyle modification is also important. Please try to reduce your stress, tensions and all, because these are main problems for the hormonal imbalances. Then try to do more and more physical activities. What? Because the lifestyle or the lifestyle modification, the physical exercises are very important. Try to be physically active again and again. And then, and always keep in mind that it can lead to the type 2 diabetes mellitus if it is untreated, right? So try to avoid the carbohydrate and the sugars. Okay, try to avoid carbohydrates and sugars, and try to intake more and more fiber and protein rich diet. Okay, next, if anybody want to know about the carbohydrate, proteins, fats, the elements in the nutrition, please comment in the comment box, I will do the video. Okay, okay, avoid carbohydrates and the sugars. Then what we have to do, we need to take more and more protein and a fiber rich diet. Okay, then the what is the treatment in order to maintain this PCOD condition? This is very enough. Okay, if it is treated initially and if it is diagnosed initially, means these are the key points is enough for the treatment. Which are those? Diet, lifestyle and increased physical activity, then cut down the carbohydrates and sugar, increase the fiber and the protein rich food. Okay, even though it's not maintaining, means we need to go for the uh, medical medicines. Okay, what are those? We are going to give the birth control pills. The name only suggests birth control pills. Here the women is unable to conceive, because here estrogen and progesterone hormones are getting lower and lower. The ovulation is getting stopped. Because of that, the lady is unable to conceive, right? Okay, when we give the 10 to 14 days course of birth control pills, what happens? The women get the regular menstrual cycle. Okay, during regular menstrual cycle, what happens? There may be a chances of getting pregnant. Okay, so next one, to regulate the correct menstrual cycle, try to take 10 to 14 days of courses of birth control pills. Always keep in mind that the regular follow up is very important. I used to see the so many patients, they don't have patients at all. Okay, they won't come to hospital even though we mentioned the follow up date. Okay, so be patient until the disease get cured, and be happy lifelong. Okay, so here what happens? Immature follicle treatment. What is this immature follicle treatment? Means the follicles are the aspiration will be done. Okay, this PCOD, in this case the follicular aspiration can be done in order to treat the PCOS, because PCOS, as I said you already, so many cysts are forming in both the ovaries. Here, even though the cysts are forming, the increased follicular development will be there. As I said you, during the from the puberty to the menopause, what happens? There may be the lakhs to lakhs, millions or follicles are present in the female ovary. Okay, if they are not maturing, what happens? Every month it has to mature and get discharged in the menstrual cycle, or maybe she used to get the pregnant with the sperm combination. Okay, if these follicles are not at all discharging or not rupturing and forming the mature ovum, what happening here? There may be a more and more follicles are forming, which can leads to the triggering the main male hormones, which can leads to these many complications. So only here what happening? They are aspirating the some of the follicles in order to improve the hormonal level and to improve the conceiving chances. Okay, so this one will be there. Then these are main treatment for these are the main treatment. Okay, what are those? Diet, lifestyle modification important, and increased physical activity important. Then proper diet should be there, cut down the carbohydrates and sugars, then take more fiber and the protein rich diet, right? Then birth control pills and the follicular aspiration in order to treat the PCOS will be there. Okay, here what is the diet? What diet you have to take in the PCOD or the PCOS? Okay, here keep in mind there will be a hormonal imbalance will be there. Maybe another risk factor is the obesity. Okay, obesity, genetic factors, these are the causes for the PCOD or the PCOS. See, here what happens? By the diet modification you can change the your lifestyle. That is, first one is the natural and the unprocessed food and the natural foods, the organic foods. Don't use more chemical used, pesticides used foods. Try to get the organic foods and take more and more green leafy vegetables, mainly the spinach. Okay, green leafy vegetables, foods high in fiber. If you want to know the rich foods in fiber, please do comment in the comment box. We'll do the another video. Then broccoli and the cauliflower. As I said, you will doing the progesterone and estrogen, you need to take the broccoli and the carciniferous foods. I told you, right? That broccoli and the cauliflower, legumes, nuts, then the fish. Okay, fish is rich in omega-3 fatty acids. Okay, these are also very important. Then the whole grains. Okay, whole grains are also important, and a low fat diet. Okay, low fat dairy is also very important, because here, because of excessive fat in the dietary content, it can trigger the increased cholesterol level. Okay, if you want to know more regarding the diet and the dietary supplements, please do comment in the comment box whichever you want to know about the food. Okay, more information regarding, please try to comment in the comment box. Okay, now we'll know about the what are the differences between the PCOD and PCOS. Next, the slides. I am going to show you some of the slides, the difference between this, and please see carefully and try to learn about the PCOD and PCOS. Okay. Okay friends, these are the some of the differences between PCOD and PCOS. Here in case of PCOD, there will be a smaller cyst, less in number, and those are grow in the ovaries, which may be reside within 3 to 4 months if the lifestyle changes has been took place. Then in case of PCOS, it is a metabolic disorder. Completely the metabolic activity is going to change. The cysts are grown both in the ovaries, leading to the ovaries stop releasing the eggs. Then in case of PCOD, it is accounts only for 10% of the women in the population across the world, but in case of PCOS, it is for 0.2 to 2.5% of the women in all around the world. But here the infertility issues can be resolved in the PCOD when you modify your lifestyle. But here in the PCOS, it's gone beyond the treatment. So what happens, there may be very serious issues can take place and the pregnancy can happen, but there may be a more chances of miscarriages also. Okay, the complications are also high. Then in here in the PCOD, no serious complications of health can take place, but as I told you already, in PCOS what happens, there may be a chances of type 2 diabetes mellitus, heart diseases, cancer, and periods can be regular. But here please subscribe to my channel Shruthi Nursing Officer. Please like and share. Thank you.